Hi, Dr. Darabi from Darabi Dermatology here. Today I want to talk to you about actinic keratosis, also known as solar keratosis. Actinic in Greek means the sun, and keratosis means thickening of the skin, or solar thickening of the skin. Why are actinic keratoses so important? They are important because almost every fair-skinned American above the age of 60 has one or two of them. And they are important because they are considered precursors of squamous cell cancer and basal cell cancer of the skin. And they are important because they signal an increased risk of also getting, unfortunately, melanoma, one of the most aggressive human cancers. How are actinic keratoses acquired? They are usually the result of long-term, low-grade, chronic UV radiation throughout our lives. And I'm talking about decades of our lives. It's that UV radiation we get from walking on the beach, walking in the park, playing a game of tennis. Over decades, this UV exposure just accumulates in our skin and causes DNA damage of the top layer of the skin, the so-called epidermal keratinocytes. And as we get older, and once we acquire enough this low-grade UV damage, we have enough DNA damage in our keratinocytes, the shingle cells of our skin, that they start to change and become abnormal. And as a result of one of the consequences of this abnormality is that we could form actinic keratoses. This is a biopsy of a actinic keratosis, which shows the disarray of the top layer of the skin, the epidermis, where the epidermis is thick, scaly, and the cells of the epidermis, the keratinocytes, are haphazardly arranged in the bottom half of the epidermis, and you see crowding of the cell nuclei, which are typical of the precancerous lesion. This could turn into skin cancer. As you can see, this looks very disorganized and not symmetrical. There's a lot of scale on top, which is the correlate for what we see on the patient when we see that rough sandpaper-like reddish-brown actinic keratosis. Actinic keratoses look on the skin like small pinhead size, or maybe a little bit larger, maybe pea size, rough patches that almost feel like sandpaper. They could be red, they could be brown, depending on your background complexion. If you're fair, they could be more reddish. If you're a little more tan like me, they could be more brownish, rough, almost like sandpaper, small lesions the size of a pea. And they're typically found, of course, in those parts of our skin that are exposed to the sun most of the time. So the scalp, face, ears, neck, back of our hands, the outside of our forearms, and the lower legs below the knees. This is a picture of a typical actinic keratosis on the cheek of a patient. It presents itself usually as a reddish to brown sandpaper-like lesion on the skin. Why are they important? Because they could turn into basal cell squamous cell cancer. So they need to be recognized and treated. And that's what we do. In dermatology, we offer our patients complete skin examinations where we put the patient in a gown and take a look at their skin head to toe to make sure we pick up any suspicious growths, and we treat actinic keratoses by either freezing them or treating them with a chemo cream that irritates them and clears them. So if you see suspicious growths on your skin, or if you're older than 60, you should definitely schedule an appointment with your dermatologist to get your skin checked. You can call us at Darabi Dermatology. Our number is 952-395-6850, or you can go on our website to schedule your appointment with the best date and time that fits your schedule. You can see my appointment availability and nurse practitioner Kendall Zeidler's appointment availability, and pick the date and time that suits you. We hope to see you soon, and thank you for your attention.